Liposuction is a very common procedure performed by myself as well as other plastic surgeons. In recovering from liposuction, it's important to understand one key concept, and that main concept is compression. Compression garments are very important after liposuction and have to be maintained for a minimum of 4 to 6 weeks and sometimes longer. This helps with keeping extra fluid from accumulating and will help with molding and shaping your body afterwards. There are many different types of compression garments that are used, and often I will help patients decide which ones are more appropriate. There are different sizes. A lot of times we'll actually get patients to get 1 or 2 compression garments, one a little bit bigger, one a little bit smaller, because immediately after surgery you're going to be a little bit more swollen, and then afterwards the swelling is going to go down, but you still need to try to get some of that fluid to come out. The most important thing next is you got to be up and walking immediately after surgery, usually within 2 to 3 hours. The reason for this is to limit any risk of something called a DVT or a pulmonary embolus. So early ambulation is very, very important. The next thing is activity. You can't go to your full normal activity after liposuction if you have a significant amount of liposuction. So typically for 4 to 6 weeks you can't do significant weightlifting or running or high intensity aerobic activity because you can have a lot of swelling. So this is very important when I tell patients this, to kind of select a time in the year when it's appropriate to undergo liposuctioning. A lot of people don't want to have a big liposuction procedure in the summer and wear compression garments in the summer. So that's an important thing to consider. The next thing is that afterwards, within a few weeks, you may see some lumps and bumps. And what that means is little areas of irregularity. For me, that's very common. And this improves just with time and aggressive massage. Every once in a while, you may have to do something called spot liposuction, which is in the office, kind of remove a small area of extra fat just under local anesthesia. And every once in a while, you have to add a little fat somewhere if too much is taken out. Again, we do everything we can to avoid this complication. The last thing that I really have liked in my experience is something called lymphatic massage. And I typically will have patients start this within 3 to 6 weeks after surgery. And this really helps with a special deep tissue massage that's administered by a licensed masseuse that practices lymphatic massage. And what this really does is actually help your body get rid of all the extra fluid. And patients will often urinate multiple times for a day or two, getting rid of all the extra fluid. Thank you very much.